Hi everyone.
Hi,
Welcome to Mama Toto Docs.
I'm Dr. Martha, the pediatrician.
And I'm Dr. Lisa, the obstetrician. And today we're going to talk about newborn care. We talked about labor, we talked about everything else, but this one, many people have asked about it. And so Dr. Martha is going to take us through newborn care from the hospital till we get home. So, newborn care.
Yes.
I'm in the hospital. I've given birth to my baby.
Yes.
Sometimes the baby is taken by the pediatrician or whoever.
Yeah.
What happens? Is the baby washed immediately?
Yeah.
Is there any contraindication to being washed immediately? Should they be washed after a week?
Yeah.
Like what happens surrounding washing the baby?
All right. So normally what happens once a baby is born, the initial minute we like to assess the baby. It's usually called the golden minute. So that's where we're assessing a score called the APGAR score, which basically is trying to see how the baby is coping with life outside the uterus. If the baby is stable, is breathing, is crying, we now go on and do our routine newborn care. Maybe in another video we'll talk about maybe sometimes if there are problems with the baby breathing, what normally happens. But routinely we'll just dry the baby because the baby is covered in amniotic fluid. They have lanugo, which is a whitish sticky substance, and they also have some hair called vernix. So normally we'll just dry the baby as we stimulate. And we don't want to wash the baby within 24 hours. We want to leave the baby with even the lanugo,
that whitish
sticky substance. Because it's important for the skin because it promotes colonization with good bacteria. So essentially the drying is just to remove the wetness, but the lanugo can still remain. And we recommend delaying bathing to up to 48 to 72 hours.
Okay, so that's not immediate. Not at all. So even that wiping will remove blood or whatever.
Yes, so that wiping is just mostly to remove the blood, the fluid that may make the baby cold. So you just want to dry the baby so that they are not wet. But the lanugo can still remain because it's beneficial to their skin.
Okay. And after these 48 to 72 hours, what is recommended to be used? Is it just plain water without using any soap, or can we use the baby friendly soaps and also moisturizing? What's generally advised?
So when it does come to that time, the 48 hours has elapsed and you want to wash the baby, we recommend mild non-perfumed baby products, both the baby soap and baby oil. It's also very important to moisturize their skin. Sometimes I hear moms saying tulipanguza tu with plain water and then leave the skin dry. No, that will make the skin very dry and they'll get rashes. So you just want to use mild product, mild non-perfumed soap, and a mild non-perfumed baby oil.
And then now this big one, immediately, I know we're advised, your baby should begin breastfeeding as early as possible.
So the WHO recommends to initiate breastfeeding within 30 minutes to 1 hour. So ideally, if it's a normal delivery, normal vaginal delivery, once the baby is born, and you place the baby on the mother's abdomen. And when the baby is on the mother's abdomen, the baby is kept warm. At that point, the midwife or the pediatrician can also be drying up the amniotic fluid or any blood that may be there. So the baby is supposed to be left there for a full minute because you put the baby on the abdomen before you even clamp the cord. So this is in a scenario where the baby has come out and is crying, is looking stable, doesn't look like they're in distress. So for those ones, we'd want things to be as natural as possible. So once the baby is born, just place on mom's belly, give it a whole minute. Then once the minute elapses, the obstetrician can clamp the cord and then cut. And normally when you do that skin to skin contact, it's very important for the baby because one, it promotes bonding. 2, it prevents hypothermia. The baby is kept warm.
Yeah.
And 3, the baby will learn how to root. Okay. So there's a reflex called rooting, which is basically how when you stroke a baby's cheek, they go looking for it.
There.
So true. You can picture if your baby is here on the belly, and the breast is just on their cheek, they start looking. They're like, I feel something nice and warm. I need to look for. So that's why it's very important for that skin to skin contact. And you find that once you do that, your baby will be able to fix on the breast and latch and actually even be able to initiate breastfeeding. So the recommended is 30 minutes to 1 hour.
To 1 hour. But not everyone gets milk. I mean, what happens in that scenario where a mother is not getting milk? How long can the baby go without, actually getting milk or getting enough milk?
And we are human beings. The human bodies are different. So it's not just textbook. So there's some mothers, and you tell me, who even start getting colostrum as early as 37 weeks in their pregnancy. 37 weeks, 38 weeks, they have colostrum. For others, it's different. I've found, especially after CS, the breast milk production tends to take a while to pick up, and that's normal because you've gone through surgery, so your body is still in recovery. So normally that may take a while. But the key essence is, even if at that moment when your baby is born, that there is no milk yet, the essence to remember is that the milk will come, and what stimulates the milk is actually the breastfeeding, the suckling
of the baby.
So what you just need to focus on is, is the baby suckling? Am I holding the baby correctly? Positioning? Is the baby attaching well on the breast? And is the baby sucking? They have a good suck reflex. If those 3 things are in check, positioning, attachment, and baby has a good suck, give it time. The milk will come.
And how do you know? So now maybe the baby has started breastfeeding. How do you know that the baby is getting enough milk? Like, what can you tell?
Okay. So once you fix the baby on the breast and the baby has fed, how you tell a baby is getting enough is one, by their urine output. So they are wet diapers.
Okay.
We don't use stool so much as an indicator because it's variable. But the urine will tell us the baby is getting enough. And normal urine is 6 to 8 wet diapers in 24 hours.
24 hours. Okay.
That's the whole day-night cycle. So 6 to 8.
Okay.
So if your baby is passing around 6 to 8 in 24 hours, that's a good sign.
Okay.
And then you also look at the baby's cues. There are those cues. So like once baby has fed, they let go of the breast and fall asleep.
Okay.
That's a fed baby.
That's a fed baby.
A hungry baby, you'll see them. They'll give you early cues and late cues. So the early cues is when the baby is just woken up, so they're alert, their eyes are open, and they're staring. Like they're starting to try to get your attention that I need something. That's usually the earliest sign for staring. Like they're trying to wake up, and that's the moment when mom should pick up the baby. The next cue they get is sucking on their fingers. By the time they're sucking on their fingers, that means you missed on the first cue. You're a bit late, but you're not too bad because they've not started now getting to the late cues. The late cues is like, oh my gosh, you missed me starting, you missed me sucking on my fingers, and now I'm hungry. Now that's a irritated baby. So they cry. And when they're irritated, you want to first calm them down. So you can cuddle them, you can place them skin to skin, you can rock them, you can just try and calm them down. Once they're calm, you attach on the breast.
That's good to know.
Yes, so they are hunger cues. They are hunger cues. Because you don't want to wait for a baby to cry to tell you it's time to feed.
That's true. Because you have to calm them down first.
And while we're still on feeding, we can talk about like the duration. So human bodies are different.
Yeah.
But we say at least 20 to 30 minutes of a feed.
Okay.
And you want to aim for the baby to empty each side of the breast. And with time, initially when your breast milk is peaking, you may not be able to tell if I'm full, if the breast is full or it's empty. But with time, you start getting a sense that this breast is now empty, so I switch to the other side. So the idea is to spend 20 to 30 minutes, even up to 45 minutes per feed. You want to empty each breast before you move to the other side. And you want to feed at least every 3 hours. The every 3 hours is a guide, so that you don't say my baby has slept 4-5 hours without a feed.
They are hungry or they are starved.
So we use it as a guide, because there are some who tell you, doc, my baby is feeding every hour. Is that normal? That's normal. In the first 2 weeks to even the month before your milk supply regularizes, you go by your baby's schedule. There are some who feed every 30 minutes, some who now feed the textbook every 2-3 hours, some who want to feed every hour, every 10 minutes. There are some who feed 10 minutes and sleep. So go with what your baby wants, as long as you're monitoring the urine output, that they're passing well-soaked diapers and they are gaining weight. They don't seem like they're not putting on weight. So that's a healthy baby. So I've talked about duration and the frequency.
And how to know if it's adequate, which is important. With the diapers and so on. And then now for breast milk production, is there anything specific that mothers should take? There's always the soup people talk about, taking porridge, etc. Is there any advice you can give surrounding that, especially around water and so on? What do you think? And then also, just another thing is to ask about is, because some people are told whatever you take, it's like the baby is also taking. So if you take things that have gas, then you're transferring gas to the baby. If you take this and so on. So what do you think about now that?
That's a commonly asked question. It's a very hot topic. But basically, for breast milk production, you need to eat a balanced diet. You need to eat just a good food. Good food, not junk food. A balanced diet. And you have to increase your water intake. So by water intake, I mean water and water-based drinks, excluding fizzy drinks. We don't want fizzy drinks. And for this discussion, we can even exclude alcohol. So I'm talking about your cocoa, your porridge, your soup. You want to take around 4 liters per day. So a simple way I used to think about it, you say 500 ml every 3 hours. And 500 ml is like the half liter water bottle. So you need to take 8 of them in a span of 24 hours. So that could be water, normal water. It can be cocoa, it can be porridge,
it can be porridge,
whatever
it can be whatever.
And you're eating your normal diet with your starch, your protein, and your veggies, fruits and veg. There are some foods that are known to increase breast milk production. They are called galactogogues. Galactogogues. It's a word, galactogogues. Different things. Again, variable effects. What may work for me may not work for you.
For sure.
So there are things like herbs like fenugreek and dill seeds.
I remember I had a lot of dill seeds.
So like for your fenugreek and your dill seeds, you can put in your water and drink it throughout your day. Then you can talk about things like oats and barley, your grains. So oats, like oat porridge in the morning, that's a good source of breast milk. It increases your breast milk production. Barley, so anything with malt. That's why in some communities, like in Europe, they even advocate for breastfeeding moms to take beer that has like Guinness with a lot of malt. But for our setup, you can get things even like Ovaltine.
Which is fine.
And legumes are also good for breast milk. Things like your dengu, But the caveat there is you want to avoid things that may make you bloated as mom.
For sure.
So if beans are making you bloated, then jahes, no, especially like after CS, I would not recommend.
Yeah.
So basically, greens also are really good. Sukuma wiki, terere, spinach. Yeah. So greens, kidogo legumes, your grains and your herbs.
Yeah.
But if you forget everything else and just remember, I eat well, so I'm eating like a good diet, and I'm increasing my water intake.
Your water intake, exactly.
You're good to go. I won't go into telling people avoid cow's milk, avoid bread, avoid animal protein. No. Yeah. Because it's not a one size fits all.
Exactly.
It may work for you and not work for me.
Yeah.
And you may actually make someone lose out on nutrients because of giving a one size fits all.
Exactly.
For nutrition, I'll just say a good balanced diet and then your water intake 4 liters in a day.
That's helpful.
Yeah.
Yeah, because we hear so
Don't
much.
overdo
Don't do
it.
this.
Yeah.
Your baby will get gas. Don't take cow products because this is what's going to happen.
Yeah.
And it's just a lot.
Yeah.
I think you've already covered that. How do I know if my baby is hungry? Because at least we look at those cues, and that's important. Now, in terms of expressing milk and storing milk, how do we go about it?
Okay.
Some people wonder how early can they start expressing milk, start pumping milk, and so on, and then how should they store it? So, like in a freezer, fridge, or if it's room temperature, what do they do?
Yeah. Okay. So, for breast milk storage, you can start at any time.
Okay.
After delivery.
Yeah.
However, there's a caveat. We want you to start pumping when your milk production has already been well established.
Okay.
So if your baby is healthy, is not having any issues, is not like in the high dependency unit or in the ICU, you can just breastfeed your baby and then you start pumping around 3 to 4 weeks when now your milk is more mature. If you start pumping too early, like within the first week of life, it may interfere with your supply. You may produce excessive amount of milk.
Okay.
And remember, your body is following your baby's cues. So your baby is actually telling your body, I need this amount of milk I need. So when you give the baby that amount and then pump, your body goes on overdrive. So you'll have an oversupply. Well, oversupply is not really a bad thing, but it may interfere with the baby's normal rhythm.
For sure.
And then another thing, at that stage, the milk has not reached its full maturity. We still have the initial fast milk, colostrum, the yellow. Which is very beneficial to the baby. You want to give the baby milk that is already has matured enough, because you want to express to give at a later time. But for mothers whose babies are sick, maybe in the ICU or in the HQ, it's fine. Whatever your body is producing at that time is okay, because anyway it's given to the baby at that time. So you can start around 3 to 4 weeks. Again, it's not a one size fits all. There are manual breast pumps, there are electric breast pumps, single, double, different bottles, different teats. Again, a lot out there in the market. You have to just figure out what works for you and what works for your baby.
Because I know some people prefer the manual, like pumping manually, and others prefer the electric. Some people want to have the wearable ones where they can do work as they're walking around. Some people use the hacker, which is just sticks there and sort of just sucks the milk out.
So there's a lot of there. Just learn what's there. And sort of figure out what works for you. It's not a one size fits. The thing you need to ensure with pumping is hygiene and sterility. So you always want to make sure you've washed your hands thoroughly and all your equipment has been washed and appropriately sterilized, all your bottles. And then for your breast milk, you want to label the bags or the containers. You write the date and the time. And then always remember, fast in, fast out.
Yeah.
So whatever you pump first, you use first.
Okay.
Whatever you pump later can be used later.
Makes sense.
Yeah. So for storage, we use this simple way of remembering 666.
Okay.
So they say room temperature, and this is normal ambient temperature, like here Nairobi. Up to 6 hours on a counter.
Yeah.
On the kitchen counter. This is like maybe hours. 22 to maybe 28 degrees.
Yeah. Okay.
If you're in like Mombasa where it's in the 30s, probably 4 hours.
Okay.
So 4 to 6 hours in room temperature, that's okay.
Very fine. Yeah. Oh, that's nice.
Then in the fridge, we prefer the top compartment of the fridge, not on the door.
Okay.
Because the door you're always opening and closing. Yeah. So you want the coldest part of the fridge. That's where you will store, and typically at the top. So the top shelf at the back, it can stay 3 to 5 days or even 6 days. Okay. That's where the second 6 comes in. In the freezer, depending on the freezer you have. So if it's the freezer that's on top of the fridge or the one connected to the fridge, it can stay even 3 to 6 months.
Okay.
Depending, because there are some that don't have a lot of cooling capacity. So I'd even move towards the 3-month one. Okay. But if you have a deep freezer, like the actual freezer one, that one I'll tell you 6 months. Your milk is okay.
Okay. So the
the third 6. You want to label it and use the first milk you pumped first.
To be the first one to be used.
When you're thawing the milk, and now like from the deep freezer or like your kawaida freezer, you want to thaw it overnight. So like if I know tomorrow I'll need baby to have milk, maybe I'm going to work, I remove it the night before and I put it in the fridge.
Okay.
So that's one way you can do it. So that it thaws slowly and then cools. And then so you want to avoid putting it in hot water, like from the freezer and then putting in hot water. No. Or freezer, microwave, defrost. No, we don't do that. You either remove it and leave it on the counter overnight, or remove it and put it in the fridge. The fridge is better because even when it thaws into liquid, it's still maintained at a cooler temperature.
For sure.
Because room temperature, it may be very hot. And the third one, you use it within 24 hours.
So there's no also taking
you
it
can't
back
now
into
keep
the
it
fridge.
back. Yes,
Nothing
you
like
can't
that.
freeze.
Okay. Yeah, that's good to know. Do you know anything about if electricity goes, what happens?
No, that's an important question. That's an important question. So depending, you see, like now the deep freezer, the those ones, they tend to be safer because they have cooler temperatures than the normal freezer compartment of a fridge. So that one I would not worry too much. But it depends. If the electricity has been gone for a really long time and it starts thawing, there's nothing much you can do. So you just move it to the fridge, use within 24 hours. If you can't, there are other ways you can still keep breast milk, but now not for drinking. Like if it stays more than 24 hours, because I feel so bad having to pour breast milk.
For sure, because the collection, the pumping of it's another thing
like
altogether.
Liquid gold.
It's liquid gold.
So you can keep that milk for other uses. There are people who use them for cracked nipples, for rashes on babies. It won't be safe for drinking, but it can still have other uses for the baby.
Because I've seen something about like milk baths, so that's what you mean. So like if they have a rash, you can put it in their water, and then now that's about breast milk. When we go to the umbilical cord, how do we clean it? And then when does it fall off? And how do you know if it's infected, not infected? Because sometimes it's not very clear.
Alright. So normally when baby is born, and the doctor now has cut off, now the pediatrician or the midwife will put cord clamps. So we normally like to leave at least 2 to 5 centimeters from the baby's tummy.
Okay.
So either 2 to 5.
Yeah, from the tummy.
5. So here's the tummy. So
Yeah.
you clamp like here. So
okay,
all this
right,
is the cord.
Yeah. Yeah.
So you want to clean at the base.
Yeah. Okay.
Where it starts.
Yeah.
Not up here where the peg is.
Okay.
You want to clean at the base.
So the skin around it, or even
where
just
it's
where it
starting.
is.
So where it's starting.
Yeah.
And then of course the skin around it.
Okay.
So we like to use cotton wool and surgical spirit.
Yes.
But you can also use a drug called chlorhexidine, which comes like in a tube sort of format.
Yeah.
But the idea is to keep the cord always clean and dry.
Yeah.
You don't want it wet around that area.
Yeah.
So around that area, so you'll come with your cotton wool.
Yeah.
So let's see the cord is starting there. You'll just clean around in circular motions.
Yeah.
You can use 2 or 3 cotton wool balls soaked in the surgical spirit, and then just leave it to dry. It's not painful.
Yeah.
I usually joke and say it's moms who feel the pain.
Yeah,
but the baby is comfortable.
Yeah.
If you just clean gently, it's not painful.
They're fine. Yeah.
So you want to do it once a day. Once a day is enough. If you clean thoroughly, like you have to do with 2 or 3 cotton balls, it's fine.
Yeah.
Once a day, and you clean it until it falls off.
Yeah.
So normally a week. Sometimes can take up to 2 weeks, but beyond 2 weeks there's a problem. So normally it should dry within a week. Most of them dry within a week.
Within a week.
Yeah. And then some of the danger signs you look for is if it becomes foul smelling.
Okay.
Or if there's pus.
Okay.
Or if the skin around becomes reddish. Or if now it becomes painful.
Okay.
And even the skin around it is painful. Those are some of the things now that would bring you to see a doctor.
Yeah, because it might now be infected.
Yes.
Okay. Okay. Makes sense. And even when you're putting the diaper, how do you advise? Because some people are like, should we put it below? Should it cover the cord? Is there anything specific, or it's just do you as long as you're cleaning it?
There are some who would prefer, because sometimes when the diaper is very soiled, it may go upwards. So some recommend, especially if the peg is big and you don't want it getting contaminated, you can tuck the diaper.
Okay.
But then also, if you were to still keep it upright and you're changing the diaper frequently, it's still okay. It's still okay. The basis is the cord stamp there should just be clean and specifically dry. You don't want it wet.
So bathing them, what happens?
So bathing them,
the cord?
so exactly. That's what I was saying. Even the bathing, 48 to 72 hours, you'll notice that we don't immerse the baby in the water. You can wash like with a shower head, and that's what they do in hospital. So we recommend waiting for the cord to fall off completely before now you immerse
them in water.
Yes.
Okay. Now vaccines. There's a lot of controversy and so many things. We know there's a certain chart of vaccines. I don't think you'll get into that. People will get it from hospital. But then, like looking at in our setting, baby-friendly vaccines versus just the normal, what we call KEPI vaccines. Is it real? Is it a myth? Because those baby-friendly vaccines are very, very expensive.
Yes.
And then is it to say now that people who can't afford the baby-friendly vaccines, that their children are at risk of so many things? And people talk about seizures, not just fever and so on. So what are your thoughts surrounding that in terms of vaccines?
That's a hot topic. Because we even live in the day and age where we have anti-vaxxers. So it's important to put out the correct information. And people should know the correct information so that they can make the correct decision based on their circumstances. I am from the school of thought that vaccines are good and vaccines work. Because we are medical doctors and we've done that training. So we come from that background. In Kenya, there are the KEPI vaccines that are available and the baby-friendly vaccines. The difference is that they will all cover against the same diseases, except that the baby-friendly one, there's a protein they've removed that makes it less immunogenic. So there are fewer episodes of fever,
yeah,
and fewer episodes of febrile seizures, because you're now given a weaker form.
Yeah.
Vaccines are weak forms of disease anyway.
At the end of the day.
At the end of the day,
Yeah.
basically.
Yeah.
But the baby-friendly one tends to cause less occurrence of fever compared to the Kepi
ones.
Both work effectively.
Yeah. Yeah.
Kepi vaccines are free.
Yeah.
In government institutions.
Yeah.
And they work.
Yeah.
Baby-friendly vaccines are available in
Yeah.
private hospitals, and they work.
Yeah.
So it's you to make the decision.
Yeah. But not to be held.
They all work.
Yeah. They do what they're supposed to do.
Yes. None is superior to the other.
What does it mean when your baby is yellow? And what should you do?
Okay.
Yeah. Yeah.
So it's a common thing. We call it neonatal jaundice.
Yeah.
So normally we have what we call physiologic jaundice, which is normal. Physiologic just means normal.
Yeah.
And then pathologic is the disease.
Yeah.
Normally we babies born in hospitals should stay in hospital at least 24 hours.
Yeah.
So even if it's a normal delivery, we like to stay with the baby at least 24 hours, because if the baby is noted to be yellow in the first 24 hours, that's pathological. So there is a problem. But jaundice that starts around day 2, 3, 4 may still be pathological, but often tends to be physiological,
which means it's
normal. Yeah. It's just because they are breaking down red blood cells, and that's what's causing the yellowing.
Yeah.
But then again, what we always recommend is you should see a doctor, see a pediatrician, because we have to ascertain the level.
For sure.
Because there are safe levels that you can be discharged home with, and then there are others that may need some treatment.
Okay. And by levels, you mean checking now?
So we need to do blood tests.
Yeah, blood tests. Yeah.
There are blood tests. There are also devices we can use to measure through the skin, transcutaneous.
Okay.
But essentially, when a baby is yellow, it's good to know the levels, either through that transcutaneous device or an actual blood test. Yeah.
So there is a reason, because some people, especially those who have had a number of children, want to leave hospital almost immediately. And don't understand why, because they're fine, they have milk, the baby is fine. So there's a reason behind it. Yeah.
There are many things you want to check in that first 24 hours.
And then skin rashes. No, that's a huge topic. I'm sure you've gotten so many WhatsApp images and messages.
Oh, my gallery is lit.
You look at this like seeing rashes all over. I mean, how do you deal with it? What are the normal rashes? Because some of them, the babies have rashes, could be a heat rash, and you're told to just let it. Do you have anything to say about it?
What I'd say about rashes, especially in newborns, the first month of life, it's normal. Most skin rashes in newborns are normal. And it's basically because their skin is still sensitive. It's still trying to adjust to now being outside the uterus. In the uterus, it was covered in fluid, so well moisturized.
True.
Now outside, it's now in contact with air, fabric. Like there's a lot going on the skin, and which brings me back to that first point of even delaying the baby. You want as much as possible to even just let the skin be. Most times rashes are self-limiting, so they will resolve on their own. But the key message is, are you using a mild soap that's non-perfumed? If this was a sponsored video, it would be saying brands, but it's not.
Just look for non-perfumed on the brand.
Just mild non-perfumed products, both for the soap and the baby oil. And even for the diaper area, after the baby has soiled the diaper, the skin wants to be, you want the skin moisturized. So you want to change the diapers frequently and then put a barrier cream so that the urine doesn't irritate the skin. Barrier creams that contain either zinc. Zinc is good for the skin. And there's another component, what's it called? The Bepanthen. So zinc and castor oil or Bepanthen, those are good diaper creams. And then of course for fabric, we want cotton. So no knitted clothes.
Yeah.
Because I told you the skin initially was just covered in fluid.
Yeah.
Softness.
Yeah. Yeah.
You don't want now rough.
Yeah, it's true.
I don't call them gunia things,
silk.
but no, you just want cotton.
Yeah.
So cotton is our preferred fabric.
Yeah. Yeah.
Avoid knitted clothes,
Yeah.
even for the boshoris.
Yeah. Yeah.
Just tell Shushu it's okay.
Yeah.
Just put on a cotton cap.
Yeah.
Avoid polyester.
Yeah.
And then in the clothes, again, mild soap. So avoid bleaches.
Yes.
Avoid very strong scented powder soap.
Yeah.
Fabric softeners.
Yeah.
You want to avoid.
Yeah. Okay.
Yeah. Good old plain bar soap is fine.
It's very fine.
For the clothes.
Nice. And we're in the tropics, but there's this thing that's, in fact, I remember with my son, it was really, really hot, and we're taking him for an appointment. And I mean, he's sweating. Why am I wrapping him in a blanket? Why am I putting socks on?
Yes.
It was hot to be hot.
Yeah.
But someone saw me and they're like, oh my goodness.
Like,
and that's a stranger. Like, why are you not covering your baby? Where's the blanket? Where are the socks? Where are the mittens? Where is everything?
Yeah.
And you feel bad, but you're like, even me though I've just seen him, he's fine.
He's comfortable.
Some people are like, the womb was very hot.
You are inside.
So now why would you come and torture someone? Yeah.